Let's review some of the common normal variants. So we're going to look at interaxial examples and ventricular examples. We have to go through a series of different type of processes. We're going to talk briefly about congenital ventricular asymmetry, cavum septum pellucidum and Berge, physiologic calcifications, and benign pineal and habenular calcifications. Again, these are normal variants, normal calcifications that we see. Here's an example of mild congenital ventricular asymmetry. We see that the left frontal horn is a little bit bigger than the right. And we can also see as we go a little bit higher at the lateral ventricle. The question is this just a congenital asymmetry, normal variant, or is there a process that's causing this? So we have to go through a mental process to say, well, if this is big, is this big because there's tissue loss in the left hemisphere, and this is compensatory dilatation? We don't see a lesion, so that's not the process. Could this be big because the CSF is not draining properly through the foramen of Monroe, which connects the frontal horn to the third ventricle? Well, we don't see a lesion there either. So this is not abnormally large. Then we say, well, what if this was normal and the ventricle, the frontal horn on the right side, was abnormally small? For this to be small, we think about some mass effects. So do we have some intraaxial or parenchymal mass that's pushing this ventricle? No, we don't see that. And then we would say, was there something outside the brain, like an epidural or subdural hematoma that's pushing the brain? So we go through all those basic concepts of exclusion. We don't see it. And then we're very confident this is just normal, benign, congenital ventricular asymmetry. Within the ventricle, there's also a cavum septum, which has the potential to fill in with CSF. We can see that there's this little balloon between the frontal horns. This is a normal variant called the cavum septum pellucidum. We look at a higher cut, and we can see that this communicates to the posterior aspect of this cavum septum. This is the cavum septum Verge. You can actually see the membrane of the cavum septum. So this is, again, a normal variant. This is not a cystic lesion that we would be concerned about. There are other cystic lesions that occur posteriorly near the cavum Verge, what's called the velum interpositum, which is an evagination of the roof of the third ventricle. Again, we have to know what are our normal variants so we don't misinterpret it as a cystic mass.